Today, I will be talking to you about caffeine. Some people don't care for it, and some people feel like they can't live without it. The three main points I will be speaking on are what caffeine is, how long caffeine lasts, and the effects of caffeine. So first, I will ask, what is caffeine exactly? We've all turned to caffeine at some point or another to give us that extra boost for a long day of work or school. Caffeine is the most commonly consumed psychoactive substance in the world. Nearly 90% of U.S. adults consume caffeine in forms of coffee, tea, or other caffeinated food products. Caffeine can also be used for medical purposes. Caffeine is a mildly addictive substance. For example, some people feel like they can't go a day without a grande coffee from the world-famous Starbucks. Be careful how much caffeine you consume because the calories can add up. Coffee generally has large amounts of caffeine, and tea in general averages a lower caffeine content per cup than coffee. Caffeine is one of the best aids and can help athletes train longer and harder. Caffeine is also a stimulant, and it can help give you greater concentration. That's why many people drink a cup of coffee before a long day of work to keep them energized and concentrated. Secondly, how long do you think caffeine lasts? Well, technically, it depends on how long caffeine lasts. The life of caffeine also depends on how much caffeine you consume. Some people say for habitual coffee drinkers, the effect of caffeine wears off sooner. The half-life of caffeine varies between 3 and 6 hours, and sometimes it seems that caffeine may only be beneficial when systemic levels of caffeine in the body have fallen between 6 and 8 hours after consumption. Lastly, what are the effects of caffeine? People who consume caffeine on a regular basis and try and get off of it are known to experience headaches. Contrary to the worldwide use of caffeine, a lot of people are unaware of the short and long-term effects of caffeine. At low doses, its psychological effects include mild euphoria, alertness, and enhanced cognitive performance. At higher doses, it produces nausea, anxiety, trembling, and jitteriness. Caffeine can also aggravate anxiety and precipitate panic attacks in patients with anxiety and panic disorder, which often results in decreased consumption of caffeine in these individuals. Some bad effects that caffeine can cause are duriasis, bronchodilation, and a rise in systolic blood pressure in non-habitualized subjects. Also, according to the American Heart Association, caffeine may cause an occasional irregular heartbeat. Caffeine consumption can also influence appetite and reduce food intake, consequently resulting as a practical method of altering energy expenditure and intake. Despite these bad effects, there are some good effects of caffeine. Caffeine can help a great deal when you haven't got much sleep. Come on, we've all tried it. Research into the effects of caffeine on sleep-deprived or restricted individuals tends to demonstrate an increase in alertness and a decrease in drowsiness. Also, when you have a headache, caffeine causes blood vessels to constrict, meaning caffeine can relieve headache pain. Research also shows that daily consumption of caffeine in coffee, tea, or soft drinks increases blood sugar levels for people with type 2 diabetes and can help control their disease. Also, several large studies have shown a reduced risk for Parkinson's disease in coffee drinkers. Harvard School of Public Health study found that women who consume 1 to 3 cups of coffee per day had a 50% reduction in risk for Parkinson's disease. Hopefully my speech gave you some useful information about caffeine. We all know that caffeine can be mildly addicting, but now you know the effects it can have. Caffeine has its good and its bad effects. Maybe after this presentation, you'll think twice about consuming caffeine on a regular basis.